Hey everybody, my name is Najee Lee and I'm a board certified life coach and professional tarot card reader. And let's just start with the results. I lost, I'm gonna say about 10% body fat. I'm extremely happy with the results. I did the peptide and hormone combo. It's been phenomenal. The results were slow and steady. It wasn't a drastic increase of energy. It wasn't a drastic anything. It was a slow, gradual creep into the actual height of the experience. And there was no part that was extreme. I didn't have any anger issues, or there was nothing extreme about the process. I really didn't even know I was losing the weight. The only reason I really knew was my clothes were starting to fit different, and people were telling me. People were really the testimonial, and it was like, hey, you know, you're losing weight, you're losing weight. And the thing about weight loss, you end up thinking that, oh, you know, when I lose this weight, I'm gonna look so different. I'm gonna notice. I really didn't notice. It was like, wow, something's happening here. Oh, wait, is this starting to show a little bit? And it's just these small little things that you got to pay attention to it, because it's not so drastic. This is not like something like some crazy wonder drug where it's just, oh my God, you lost 50 pounds in 2 days. Like it's a very gradual thing. It's a healthy thing where your body starts to shrink. Working with Michael was phenomenal. The phlebotomist takes your blood work. You scheduled that on your own time. They come to you. Working with the doctor, Dr. Eberwein, super great experience. Everybody's friendly, they're professional, they're confidential. And the process is quick in terms of the service. Like they're not beating around the bush and playing with it. I mean, they put it in, boom. I think it's 2 days. The thing gets sent out to you, and you're ready to go. The instructions are clear. It's easy. You just go ahead and set it up. I was on the Monday, Wednesday, Friday in terms for testosterone, and also I was doing it 3 days a week. And the results were, when I started doing the process, I didn't really notice much. It's just little gradual increases, which is the way I think it should be. It shouldn't be just big spike into where you're addicted and you feel like, you know, an addict. It's a very gradual, very soft thing. And my mom and other people are like, well, how is it? What's going on? I'm like, I don't really notice much. It wasn't such a profound difference, but there's a difference in the body that happens over time. And this is really what I loved about it. It wasn't just hit and disrupt your nervous system. It was a very, hey, you know, easing into it, almost like a walk into a fast walk, into a jog, into the sprint. And then the body starts to acclimate to the process. And that's the best thing. And what was I? Now I'm able to fit an extra large shirt. I was at a size 42. I dropped down to a size 38. I haven't worn a size 38 since middle school. And I went to Express and I said, if I can fit a size 38 from Express, then I know for a fact I'm a 38. And I'm a 38, I have an extra large shirt from Express. And I'm like, man, like this is crazy. It feels unreal to fit into a size 38. Like I don't have to go to the big guy section or big and tall. Like I can wear something that's normal size. I can get the cool clothes, and I'm super happy about that. And the one thing that Michael told me, like, you know, you can't eat whatever you want and think, you know, I'm on testosterone, I'm just gonna just muscle through it. You want to be smart about the process and recognize that you can out-eat your treatment. You can out-eat it and thinking, oh, I'm on testosterone, I'm gonna burn it off, going to the gym. You want to be smart and develop that self-love, self-care routine. And so how quick did I start to feel the results? I mean, I didn't really feel too much in the beginning. I'm gonna say maybe 2-3 weeks in, that's when people were making more comments. I started to feel a little more energized. I think I got maybe about an hour or 2 hours less sleep, and I was waking up more fulfilled. In terms of my energy, in terms of the gym, I started noticing like the difference in my shoulders. And when I lift, I started recognizing the pump was bigger. I had more strength, more explosiveness. Once again, this was like very subtle things. I wasn't going from 315 to 350 overnight. It was just feeling like, whoa, like these contractions are stronger. And that's really what you want to feel. You want to feel the contraction in the bicep and the shoulder and be able to feel that pump. And I felt that. And the energy was good. It was lasting. Libido straight through the roof. That's going to be the first thing. Actually, the first thing that I noticed: libido's going up, sex drive going up, erection quality goes up. That's probably the first thing that happens. Yeah, that's the first thing that happens. So for guys who are looking for that benefit, you're going to notice that before the fat loss. There was no extreme mood changes. There was nothing crazy. The only thing that was just a little disturbing, like for me, was the injection site. And I did it in my thigh, and I got some swelling. And Michael was like, "No, bro, do it in the shoulder." And once I did it in the shoulder, that was it. That was the end of that. And what made me consider doing the testosterone therapy? The testosterone was low, and Michael was like, "Hey, man, your mind is brilliant, but your body's not matching up to what's going up here. So let's get you optimized." And it really helped me get optimized. It helped me, break past that plateau where I was at, give me that motivation for me to get to the next level, to give me that boost in energy. And I already lost 120 pounds, and just trying to get to that next level with those low test levels at 200, it was going to be difficult. And to drop the amount of body fat, I could do a pull-up now. That was my goal. Since I was 7 years old, I've never been able to do a pull-up, and I've been working at it. And now I can do 3 pull-ups, chin above the bar, not chin up, pull-up. And I'm extremely proud. That feels good to get above the bar. Obviously, I had to get lighter and I had to get stronger in order to do that. And during this time I was doing the therapy, I was able to achieve that goal. And that was I'm extremely proud of myself for doing that. The therapy, you've got to work it. Sitting down and just eating, you can't out-eat the therapy. I mean, it's a gradual bioidentical thing. This is not a point where you're just stuffing things into your system and expecting a pharmaceutical god to come and save you. No, this is to put you at a good level so you can do the things that you want to do. And that was it. So it's a little easy to get that, I've got this in my system, to want to cheat it with the nutrition. And I found myself doing that sometimes. Hey, you know what? I can kind of get away with it. I can get away with it. But then it was like really helped me become more disciplined. And like, hey, you know what? Stick to what you're doing. This is the help. This is the help you needed to get that metabolism going. And what I say to someone considering doing it, I would say, do it. I would say for me, I did it for a temporary thing. I did it for about a year and a quarter. And for me, it was a temporary thing. And for someone who needs it, go for it. For long term, if you need it for long term, do it. For me, it was a short term thing. And even for the short term, I would still say do it. Why? Because during this time, you get that boost. You get that increase in courage and confidence, not because you're just taking something, but you're starting to see the difference within yourself. And it really helps you hone in and find whatever weakness that you were working on. So as you're working through that weakness, you're getting this boost, you're getting the results. And now, hey, you know what? You're able to solidify that deal, close whatever you were trying to do out and get it done. So I would definitely say it. Let me see. Was I skeptical before starting? No. Wasn't skeptical. I was just like, hey, you know what? Let's do it. And I was a little scared, honestly. I was a little hesitant because I didn't know what was going to happen. And, I thought it was going to be this very big difference. And I thought, if I get off of it, my gain's going to be unsustainable? No. It was more fear going into it than anything. And feeling like I might be addicted or I might not be able to cycle off, or that was the main fear. But none of those things have happened. It's been a very gradual process, and you don't feel like you're on something. It's not like you're smoking a joint or you're drinking alcohol where you feel this huge difference and then it hits you in the face and then you have to recover and come back to reality. It's not like that. It's almost like you're eating vegetables or something, and it's like, I feel fresh, I feel nice, I feel different. Okay, this feels good. I feel a little stronger. I feel a little this. It's this very gradual thing. And people have been to my testimony, people in clothes. The clothes, wow, okay, wow, this is getting big. This is getting bigger. These pants are getting bigger on me. No, I'm getting smaller. And that's what's been going on. And people are like, hey, you're losing weight. Hey, you're losing weight. And then it's like, I'm losing weight. Okay. I guess I'm losing weight. All right. I guess I'm losing weight. I guess I'm losing weight. And that was the thing. So the peptides and the hormones, the testosterone, that combo together was great. I'm so grateful for the Medical Health Institute. Yes, thank you for doing your thing. Thank you for just for having this combo. Thank you for customizing it to whatever I needed, so it didn't take me over the edge. It was what I needed, and yeah, man, it's been a great experience. I'm very happy to have done it. Thank you so much for everything. It is a life changer, not a punch in the face life changer. It's a very gradual life change. And then once you kind of stop to smell the roses and look around, that's when it's a punch in the face. Like, yo, like, this happened. This change inside of me, these results I want to see, gain in muscle, fat loss, increase of energy, that increase of libido, all these things that we talk about, they happen very gradually. And it's very nice that it's comfortable in the body where these things, where it's not this huge drastic change and then boom, it's all gone. It's a very gradual thing that feels good. So anybody that's scared about this gradual radical shift in hormones and mood and all these things, that this is bioidentical. This is not some increase in massive amounts of stuff pushed into your system. So it's very gentle on the system. At least it was for me, and that's my testimony. I'm happy I did it, man. Thank you so much. Thank you so much. Later.